All right, thank you, Tony. Next on the list is Rhonda Hughes from Horizon Health. Take a moment.
He's very tall. I'm short. There we go. There we go. All right. Can everybody hear me now? Good. Okay. I'm Rhonda Hughes. I'm with Horizon Health. I'm the compliance administrator there. We were actually participated last year, and we've had a lot of new programs that we've added to our services, both in London and Williamsburg, and we'll be speaking about those later on in another workshop. To mirror some of the things that he said, we have ventured into transportation because we found that that was one of our clients' biggest barriers to treatment. A lot of them are rurally located and they have problems getting rides back and forth to treatment, so we implemented that program. We've also got child care, which we had last year. We have a state-approved child care facility inside of Horizon Health Clinic. Now, if you talk about jumping through some hoops to make that happen, we had to jump through a lot of hoops to make that happen. But we provide that service for our clients. We offer MAT services. We also do counseling. We have employment services. We also have the second in the state ADHD testing site that uses the only FDA-cleared software to test for ADHD in kids and adults, and it's open to the public. So we're hoping to get the word out about that because the way that came about was last year we did some research with our patients, and we found out that a lot of our methamphetamine abusers, there was a high correlation between that and ADHD, because a person that has ADHD, the methamphetamine, when they use that, that actually has the opposite effect of what it would have on somebody like me that never has. It calms them down. Somebody like me, it would put me in the hospital. So a lot of them didn't even know why, but they were trying to self-medicate. So we implemented that program, and I'm not going to talk about too much more because we got other ladies here that want to speak as well. So looking forward to it.
Thank you, Rhonda. Well, we're just going to have to keep switching this back and forth probably, so I'm just going to bend over. All right. Next on the list is Brooke McLean Nipper, who's the Director of Behavioral Health at Grace Health.
Good afternoon. So Grace Health was started many years ago. Back in 2008 was the first location. It was primary health. As time has went on, we have expanded, and we are integrated healthcare. We're an integrated healthcare model with both primary care and behavioral health. We're also adding dentistry. We have pharmacies, and so the only thing we don't have yet, I think, is optometry, and I'm sure that's coming down the pipe. But I'm sure if you're from Corbin or been in that area, you have seen our Med Campus location, which is in the old Kmart building. And we have in that building, we will be open this summer. We will have behavioral health, primary care, pediatrics, dentistry, and pharmacy. So it will be a one-stop shop, so to speak, for integrated healthcare. In behavioral healthcare, we have 5 clinicians, 2 that are trauma-focused. They have been in trauma-focused training. We have 7 care coordinators, a targeted case manager, and 3 psychiatric nurse practitioners. Over the next year, we hope to add a clinical psychologist and to continue to grow and expand our behavioral health programs.
Thank you, Brooke. Next on the list is Kaylee Brooks, who's the Director of Outreach at StepWorks, and Aaron Smallwood, who is the Clinical Services Director at StepWorks.
Hey y'all, are you awake after lunch? So this is StepWorks' second year at Union, and we are really happy to be back and in a room full of like-minded people in our field. So I am Kaylee Brooks. I'm the Director of Outreach with StepWorks Recovery Centers, and this is my colleague, Aaron Smallwood. He is our Clinical Services Director. We've got some of our StepWorks peeps back there, so you might hear some things out of them. So we're just going to talk to you all briefly about how StepWorks got started, where we are now, and why it's so important to us and what it means to us to walk with our patients throughout their recovery journey. So I've got my notes here. Y'all know I got to look at them. Okay, so StepWorks did start with a small staff in a small town in Elizabethtown, Kentucky. Y'all know where that's at? Dr. Tom Ingram, one of Kentucky's leading experts in addiction treatment, founded StepWorks in 2003 to improve the quality of inpatient addiction treatment in the area. So in 2013, Dr. Ingram sold the original StepWorks location and reopened StepWorks 2 years later in the closest facility that we now have to Barberville in London, Kentucky. So while some things might have evolved and changed with StepWorks since its inception in 2003, our core beliefs have not changed. So the first core belief that we have is that addiction is a brain disease. Number two is that stigma and recovery don't mix. I know that's something that we can all say hallelujah to in this room. Recovery starts with you, and we believe that recovery is better together. So we do not believe that patients can recover in isolation. So here at StepWorks, our motto is that we will walk with you. So since that time, the growth for StepWorks has been amazing. So in 2023, we now have 6 facilities across the state of Kentucky to best support our patients' recovery journey wherever they are. So we have 2 gender-specific facilities for males, one in London and one in Paducah. We have a co-ed location in Nicholasville, a co-ed location in Bowling Green, and 2 co-ed locations in Elizabethtown. So we provide medical detox and individualized residential treatment services at StepWorks, as we don't believe in the one-size-fits-all approach. I know that's something else everybody can say hallelujah to in this room. So all of our medical directors at all of our facilities are board certified in addiction medicine, and they're ASAM credentialed. And our patients engage once a week with our medical directors who are dedicated to that patient's well-being and their care when they're with us. We also have the capacity to accept more clinically and medically acute patients at our facilities. So I'm going to turn this over briefly to Aaron to talk about what a day at StepWorks for our patients look like, and also talk about our culture.
Thanks, Kaylee. I think I'll just, because I feel like we're overachievers up here a little bit. Maybe we're getting long-winded. So I'm just going to talk about our culture just for a second, and then I'll turn it back over to you. But at StepWorks, when we think about, closer. All right. At StepWorks, when we think about culture, we think about, we don't know who our next patient is going to be, and we don't know their story, and we don't know the details of their journey that brought them to our program, but we know that human beings are social beings, and the most natural thing that we can do is absorb into our social environment. So at all times, we're trying to keep our finger on the pulse of what's happening in any facility, because we know that the newest patient very likely is going to simply absorb into the collective mindset of what's happening at the facility when they arrive, which means attitudes are contagious, beliefs are contagious, perspectives are contagious, and that's our philosophy when we think about culture. And so the other thing that's sort of a guiding philosophy in our culture is that we believe that addiction grows in a very specific environment. Whether you want to consider the genetic factors or the environmental factors, the environment's the same. And addiction prefers an environment of emptiness and loneliness and disconnection and simply just lacking a sense of belonging. And so understanding that about our patients tells us what our mission is in our programs. Our mission is to work together as an organization and as a staff to build, not just among the patients, but among staff and patients, a program that exposes them, some of them for the first time in their entire life, to what it feels like to belong. We all have this innate desire to be understood. And so to actually have someone understand you for the first time, speak a language that sounds familiar to you. These are the things that we're trying to build in our programs. And we know that if we give them a taste of that in our programs and they sort of experience the emotional and psychological benefit of that, then that will promote them to seek the next steps in their continuum of care and sort of continue with the momentum that they created in our programs. And this is not just a pretty phrase you put in a brochure. This is what we're trying to do. And I feel like we've really increased our capacity to do that over the last couple of years. So.
Thank you, Kaylee and Aaron. Okay, so the one thing that I noticed about everybody that spoke is you heard elements of every that were mentioned by every one of the previous speakers, which I think is a great thing for our communities, and it says a lot about the effort that's putting into developing recovery services in this area. So I have a list of questions that I'm going to go through, and one of the things, we were going to just pass that microphone along. I'm really hesitant to pass this one along because somebody will trip over it, and it'll most likely be me. So I'm just going to, I guess, ask a couple of you to come up for each question and try to spread it out a little bit. Okay. First question is, what are some of the most frequent misconceptions about addiction treatment programs? And Tony, do you want to field that first one? Rhonda, do you want to?
Exciting movement up here today with all these microphones. Do either one of you all? Oh, no.
I think that and when talking about stigma, I think, or misconceptions about the disease or about treatment, I think one of the things that I've learned from my patients over the years is that stigma is driven by this external force. It comes from social factors, but more importantly, it gets internalized by our patients, and our patients start to see themselves through the lens that society sees them through, and they start to think, maybe I am broken. Maybe there is something wrong with me. Maybe I am just too weak to quit, or maybe I am so selfish that I can't quit, or maybe I'm just so morally bankrupt that I can't quit, and that's why I've not been able to, I continue to live in this compulsive cycle. And I think that's one of the things that we really try to stress is that substance use disorders and addiction are a brain disease, and that brain disease has manifestations that present as this obsessive compulsive loss of control. And so psychoeducation is a very important part of reducing the shame and the stigma and accurately sort of educating them about this disease and helping them hear the message that says, you're not a person that's devoid of love. It's not that you don't love your family or love your kids enough to stop. That is not what's wrong with you. What's wrong with you is that you have this disease that sort of creates a barricade preventing your love from flowing in and out. And that's a very different way of understanding this disease. And when patients hear that for the first time, you can see relief sort of wash over them, right? When they finally hear someone say to them that you're not a broken individual, you're not a person who doesn't love. It's just you have to figure out how to engage in something that brings your love back into your life. I think that's an important message.
So I feel like my name's Ashley. I'm with Horizon Health with Rhonda and Jennifer. Jennifer's one of our practitioners. She does this every single day. With stigma-related issues, though, if you all are in recovery, you have the same goal as all of us sitting up here, right? And it's to meet people right where they're at. The stigma that I find with recovery is that it's not the people within recovery that's trying to help. It's those that are without, like your law enforcement. Even some providers have a stigma about meeting that patient right where they're at and just kind of hanging in there with them. So like when we go to law enforcement with the stigma, just to try to approach them a lot of times, I feel like that it's community. I think that, you have to let people find their identity and who they are, really who they are, because a lost identity has people searching for anything to fill that hole, right? So I feel like that even law enforcement is very stigmatized. Our communities are very stigmatized. And what we do in recovery is we meet these people, we meet this person right where they're at, and we make them feel welcome. And I know that there was times that when we opened Horizon, some of the things that the patients would say when they come in the door was like, hey, they wouldn't even let us sit on their furniture at the practitioner's office that we went to, and we had to come through at a certain time and be ran through as cattle, right? So you have to make people feel like that, hey, you're welcome here. We want to see your lives changed, and we need to feed those testimonies back out into our communities about what's working and what's not. And that's what ends stigma, is other people's personal stories.
Thank you very much. The next question on our list is, what are some of the barriers to addiction treatment?
I think we've already kind of talked about the barriers a lot today. Transportation, of course, is being one. And a lot of people don't understand that your co-occurring disorders is a barrier, because if someone is trying to overcome addiction, they have to treat the mental part of that as well. So that's also a barrier. Education, employment, all those are barriers that we don't see. If you're not focusing on, it goes back to Maslow's hierarchy of needs. You've got to focus on what the main needs are in the beginning. What are we meeting? Are you eating today? Do you have a house to live? Do you have a place to go? And I think a lot of people don't understand that that's where we really need to start at. And that's where she kind of has said too about meeting the client where they are.
I'd have to agree with her. I mean, we run into the same barriers, I think, with all treatment centers, because we're dealing with the same issues of folks that come in to get treatment. So, transportation, housing, that sort of thing is always a barrier for these clients. So we try to use a lot of community resources to overcome those barriers. We got voc rehab, we've got transportation that we provide to and from clinics and things that they need to get to, dentist appointments. So we're always trying to overcome those barriers to get the client the progress they need. So.
All right, thank you. The next question on here is, what makes the difference between a successful and unsuccessful treatment program? you want to come over and get it so I don't hit people in the head?
I mean, I suppose that's the question of all questions. I feel like the number one thing that you have to do, and she talked about Maslow's hierarchy of needs, and we know that addiction interferes with a person's self-efficacy. So you have to meet their basic needs first. Our patients are most of them coming from environments where they were in survival mode. So you have to work first to bring them out of survival mode. And the second thing I really feel like is the most important is the psychoeducation process. One of the things that we teach to our patients is that you will never overcome an enemy that you do not understand. And so we go to great lengths, and at StepWorks we have our own curriculum that we developed that really educates the patient about their disease so that they can generate adequate solutions that equate to long-term success and recovery. And then outcomes matter, and we want every one of our patients to go out into the world and be successful citizens and be employable and repair their relationships and develop a sense of purpose. And that's one way to measure success. But I think a better way to measure it, and we focus on that, but we focus more on this. Our job really is to plant seeds. And so when a patient finishes one of our programs, when I think about was it a success or not, I ask myself, did we educate them about their disease? Did we put them in contact with some spiritual solution that addresses the spiritual problem they have? Did we help them encounter human connection? The most basic and fundamental human need is to feel connected and to feel like you belong to something and to feel like your life has meaning and purpose. Did we help them create momentum, moving them in that direction? And then did we show them the road forward so that they know exactly how they can continue that momentum? And I feel like if you do that, you have to call that a success.
My name's Jennifer. I'm one of the nurse practitioners at Horizon Health. I really feel like success is measured on an individual basis with all of our patients. Even breaking it down to the smallest part where somebody has a clean screen 1 week. It's a huge success for them because their life is full of struggles, full of negativity, and it is important for us to recognize that even though they may have 10 dirty screens, they have 1 clean screen in a week, and that's important to build them up and boost their confidence. We try to treat people, all of our patients, like they're human beings at the clinic. They were someone's baby, they're someone's mother, brother, sister, uncle, and it could be any one of us sitting in that seat. And I would surely like to think someone would treat me with the same respect if I was sitting in that seat. So that's success to me. I think they have kind of said a lot about, but what you really hit the nail on the head was caring. And I think Jeff had talked a lot about that earlier in his presentation. And a lot of people, I think from an administrative standpoint, I always look for people who are going to, you're looking at people that you're going to hire that are going to care about people and that they're driven by a mission to help people in this crisis. And so that's kind of what you look for. You want that. That's the basic thing that you have to have is somebody that's going to, and from a spiritual perspective, be the hands and feet. And that's just what I would look for in anybody that I would hire on to be a part of our programs.
Thank you. Next question. What are the components of a comprehensive treatment program?
I think the components of a comprehensive treatment program at Horizon, I can use us for an example because that's who we are. We have a whole campus of care approach. At Horizon, when you come through the door, you don't just get mat treatment, you have a daycare on site. One of the things that we learned early on was that parents don't want to choose between their recovery and their child, right? So then when they come through the program, when they come through the door, we have a lot of our workers here, even Matt here in the front, they all automatically get into case management services where we provide them with food boxes as they walk out the door, because how can you do counseling if you're sitting there hungry the whole time, right? And then we provide them with clothing if they don't have that, because everybody wants to look nice and look their best and look like, you know, they have it together, even if it's the second visit, right? So we do that as with our counseling or with our case management, and then they have counseling. So we focus as a campus of care on the counseling side of everything, because we like to do cognitive and behavioral therapy counseling, which changes their way of thinking about things and does a reward system pretty much. So we like to reward them, like they come through at a first phase, they do a second phase, and then they do a third phase. And that third phase usually is, you know, later on, and they feel rewarded with that. Like they can do telehealth services instead of coming into the clinic and things like that. So we try to accommodate them so that they don't have to miss their recovery. And it's not a punishment if we say, well, you can't make it today, so I guess you're not getting your medicine, or something like that. Like that's kind of the mentality that a lot of them come to us from, because they said they got kicked out of a clinic because they couldn't get there because of transportation, right? And then we even have with Rhonda, she wrote a workforce development grant for Horizon. That way we can put them through GED classes and different things like that. And she can talk about that in the next thing a little bit more in detail that we're going to be doing. But when we say a comprehensive care approach, you really have to focus on all aspects of that patient and meet that way. Instead of setting them up for failure, we set them up for success, right? And that's what we try to do early on with Horizon. That's what we try to do. And I think that when they come to one place, they can get all the services that they need. And even Brooke, next door, Horizon or Grace Health is right next door to us. So we have a pharmacy on site. It's a B41 pharmacy. Is that what it's called? And they get their scripts really cheap if it's something other than what their insurance would pay for. And we can just send them over next door to them. And we just try to basically accommodate that client or patient with whatever they need at that moment. So.
Just to add a little bit to that, also, you know, we're not, you know, we collaborate, all of us, and, you know, I've met with StepWorks, I've met with, you know, several different rehabs. If you don't have that collaboration factor in this community, we're not going to have any success in this area. And so it's so important to have those connections and not look at that from a competitive standpoint, but look at it from a helping standpoint.
Brooke, I had you there. And I really think you answered that question very well. It's about working together, because I don't think there's an agency out there that's prepared for everything that a client will bring, and that willingness to work together is very important to having a comprehensive treatment program. So the next question is, how do you evaluate the effectiveness of a treatment program?
Well, it's a little bit difficult to evaluate the effectiveness because it's a continuing of care. You know, one way that we do is, like Ashley was saying, we move our patients up into, we have 3 phases. Phase 1 is weekly, phase 2 is biweekly, and phase 3 is biweekly, but once a month screen. So that would be one level of care that we would say would be a success on a patient. But I don't know, what do you have any other examples you think that, as far as that goes? Yeah, employment, the maintaining jobs, you know, definitely is another aspect of keeping their weekly appointments. That's, we do, you know, we reward those patients by being compliant with their weekly appointments. That is the big deal. A lot of them, like I said, you know, they have all these other factors that are barriers, and just being able to maintain coming weekly is a huge deal for them. So we try to bring that to their attention and acknowledge it.
All right. Okay, that was, I mean, that was certainly a good answer. So what's currently missing in treatment and treating addictions? Anybody want to give a stab? Aaron, can you?
And some of the questions that were on the sheet that we were going to talk about, we were going to talk about prevention, and I don't really know if I'm the person sitting up here that's really qualified to talk about prevention, because I work in residential treatment, so I'm focused on intervention, and I'm focused on helping people who are already caught in the grips of this disease. But when I think about prevention, I think about this quote, which quotes are memes now. So there's a meme that's been floating around on Facebook that says, we need to do more than just continue to pull people out of the river. We need to go upstream and figure out why people keep falling in. And I think this is where our focus, we need to be focusing on intervention and treatment and symptomology and all the stuff we're focusing on. This has to happen. That's the most immediate need. But what's happening upstream is often ignored. And I think as a society, sometimes we're very slow to pay attention to the lessons that life has to teach us. So there's been some conversation today about what we learned through COVID. And when I think about what did we learn through COVID, well, there's just a very small phrase that tells us all we need to know, and that's social distancing. So what happened to us as a society during COVID? Well, our connections with the people that we love were disrupted. And we saw all sorts of adverse side effects or manifestations of what happened when our relationships between other people became interrupted. And so, I know Tim was talking about this morning, but I feel like that was a lesson about what a pandemic can do, but it was also a lesson about human nature, because the problem that we're experiencing as a society is deeper, it was pre-existing before COVID ever happened. And so I guess what I'm saying is there's something about the fabric of our society that we need to look at. There's something about how we're going about the business of living life that causes us widespread emptiness as a society, widespread lack of a sense of belonging, widespread lack of purpose. We live in a very individualized, material-focused society. We live in a very comfortable, lavish, materially rich society, but we're also the most depressed, anxious, addicted people in the history of mankind. That is not a coincidence. And so when I think about prevention, I think a prevention measure or anything that safeguards against the developments of addictions is any program, any activity, anything that we can do that helps a person generate belonging, connection, purpose, fulfillment, those things. I feel like those are the things that we're missing as a society. And if we would go back upstream and start figuring out what's going on with us that's causing us to be so disconnected, we would by default safeguard people against developing addictions. So.
I want to say that I think that the biggest thing that's missing is education of the public and also educating medical providers. We did a little survey last year, and we just surveyed medical providers in our county, and we found that there was a high rate of bias that existed towards SUD patients by medical providers. So what that told me was the stigma is very strong in a rural community. It's actually amplified more than it is in a suburban community, and that we need to address that. And the only way I think that we can effectively do that is through education and educating people about the disease itself, because many people don't realize it is a disease. They think it's a choice, and it's really not a choice. Coming from somebody with some experience back in the 80s, early 80s, when I was a younger person, I was involved in a car accident, and I was hurt pretty bad in that car accident. And the first thing they sent me to was a pain management clinic. You can guess pretty much where it went from there. They wanted to put me on oxycodone and pretty much I couldn't even function. So I took myself off of it. But with that being said, I did that within 3 days. For most people, if they're put on a drug as strong as that, an opiate as strong as that, addiction starts to occur when they hit that 7th day of taking that medication. And they don't even realize it until it's too late. So a lot of the people that we see now in our program, they got addicted years ago. There just wasn't treatment available. So I think educating more to the public and to our law enforcement and our legal systems, our probation and parole systems, and even our child protective services systems, they need to be educated about the disease and that it is a disease.
And both of you mentioned stigma, and as we all know, stigma leads to self-stigma. You get that message from the medical providers. How likely is a person to go to seek help, even for a life-threatening condition? So that has many more consequences than I think a lot of people realize. Next question. How do you see the future of addiction treatment programs?
Can I be honest? Well, I don't want anybody to get mad because I know everybody here is passionate about their job, but I do work with a lot of insurances. I actually do the billing now at Horizon. When at first I helped open the facility in 2019. I've been moved around a lot. Whatever they need is what I do. So I'm just the team player pretty much in that. But what I would like to say is I have heard a lot of talk about, and I'm just being honest, okay? So we'll be best friends after this. The insurances are not happy right now, especially with the state of Kentucky, that I know about patients coming into a treatment center and then just outpatient and leaving, going to the next one, going to the next one, going to the next one, okay? So I feel like that this is going to phase into eventually, so be prepared, long-term cares that make these patients be committed to getting treatment and sticking it out. So like a 6 to 9 month program, a housing program where they can get the treatment that they need to, but their lives are changed in that, because what they're saying is basically what the insurance are saying is basically every month they're at a different clinic. They don't stick it out. And they're not seeing the improvement in their lives because there's no long-term sustainability in the life of that individual. Like, are you working on to get them off of the medication, or are they just continuing to stay on the medication? And that is the truth. I had a high individual that's high in the politics actually say that to me, that they had talks about what can they do in the future, because this is a big, for an MCO in recovery, they come weekly. It's not like they go, get their blood pressure checked every 3 months or something. This is like a lot of revenue that has to come out of the states to be able to accommodate these types of treatments. And they just want to see successful things. So what I would say to do if you are a recovery and the future of it, I would say to give them some stable roots. They need stable roots, and I don't know what stipulations or regulations that they're going to put in place to make sure that happens, but I do think that that is where we're going.
Go ahead. I can't reach the microphone up there. Yeah, I mean, we can't speak on behalf of Medicaid and that kind of stuff. That's probably an afterwards type of. She'll get with you after we're done. All right, we got some prevention questions, and we got about 10 minutes left. So I'm going to give Dr. Mooney 10 minutes to answer all these prevention questions. I'm sorry, I was joking about earlier today. Okay, so what do we need to have effective prevention initiatives or programs to look at? It's stuck.
I think a lot of people are, kind of on either side of the fence of this, but definitely more Narcan available in a lot of our areas, a lot of our clinics, and a lot of things that instead of being available and being readily available to somebody that needs that, I think that's definitely something we need to look at as far as prevention measures.
Yeah, I'm on the Knox County Coalition, and we're in the process of trying to put those Knox boxes countywide. So I do think that it would be, like she said, extremely helpful to have those throughout.
Just a real quick comment. A shout out to Knox County Jail. I went there recently, and they actually have a vending machine in the lobby that's stocked with Narcan. And it was the first one I'd seen. So I thought that was really a good preventative measure.
I'm very encouraged by some of the programs that I have seen in some of our schools, and I think school systems are a place that we really need to focus on our programs, especially because, as Jeff Wilson was talking about earlier, the correlation between childhood trauma and the development of SUDs and addiction is so clearly documented and evidence-based that the more programs that we have to help identify trauma manifestations in children and address those before a substance use disorder actually develops from it, or those at least those sort of behavioral manifestations that sort of disrupt a person's life and lead to the development of substance use disorders. So I think any focus that we can give to developing programs in schools that help address trauma issues, addiction-related issues, prevention issues will go a long way for us.
Somebody that spent their first 20 years of their career in school, as a school counselor, I agree with that wholeheartedly, because I feel like that there's so many aspects now more than ever that our kids are facing. And so we have to start addressing those things early on and getting those good fundamental counseling programs into our schools.
Thank you, everyone. And I believe we had a little bit of discussion about preventing overdose, right? Which is definitely a need in this area. And one of the things that I didn't hear mentioned, but I think it's important that everybody hear, there are quick response teams throughout the state. If a organization is notified of an overdose, they'll send somebody out to talk to that person if they've survived the overdose. I know locally we started a crisis stabilization unit for people with substance use disorder to try and at least get some brief treatment done with people that are not willing or not at the point to where they want to go into residential treatment yet. So I guess my response to all that would be aware of the resources in your area. There's most likely some resources that you're not aware of. Okay. Next, how do we evaluate prevention programs?
I think one way we could evaluate is by measuring the amount of overdose deaths that are recorded each year. Through the University of Kentucky, they make that information available. Unfortunately, right now, it's when you ask for the report, it's usually about 5 months back from what time you're actually asking for it. So the information's only available for example, last year, you can get up through third quarter of last year's numbers, but there's none for this year. So I think one of the things we do need to do is work on some type of real-time reporting mechanism to where we can see those spikes as they occur. And that way we would be able to track our prevention activities and see if they're working. If we see a spike, then obviously we need more activities in that area. So if we had that real-time reporting capability, we could address those things before they got out of control.
Okay, what would be some prevention actions that could be taken by family, school, community, addiction professionals? And how could each one of those help? Could you repeat that? I need to find it here. Okay, what would be some prevention actions to be taken by family, school, community, or addiction professionals, and how could each of those help? Go ahead. No, you're good, and that's exactly what we want. You've sparked a thought.
So we have tried several times to get into our local community school boards. No, they will not even respond back. Do you know why? Because if the problem is swept under the rug, they don't have to address it. Okay? So that goes back to stigma. And exactly, that says that there's a problem. And what we are finding is that when they do not respond to us, there is an overwhelming response right now with children that are teens. My nephew being one, when he hurt his shoulder in football, he literally made his other shoulder because they had addicted him. This is a 22-year-old boy. When I went to the school board to speak to them, they would not talk to me about this. And the doctor was the one that fed him the script. And the school was the one, when he was injured, that didn't even, they didn't want to address it. And this is going on with school athletes. There's a lot of school athletes right now that are addicted to some type of substance. And it is a problem. And I think that individuals like us and the parents have to rise up and be a voice in our communities and say, this ends here. We should have a say in our next generation. You know, that's what's going to usher in the next, what's going to happen in society. So we should have a say. We should have a say in our society. And I think it's going to come to a point where it has to be done professionally, but it has to be called out on the forefront.
Just a quick comment. I think two things. If teachers and parents in schools want to give their children a gift, a prevention gift, it would be to learn from what happened in the 90s and the 2000s with the overprescribing of opioids and talking about limiting access, which, I mean, that's an easy thing to say, limiting access. That's an obvious thing. But I don't think it's something that we should ignore, because we saw just exactly what overexposure to substances can do. And then we also saw what happened in 2012 when the prescription drug bill when House Bill 1 was passed, and you had all these people who were chemically dependent upon opioids, and then you took away the opioid. Well, what happened then? Well, heroin exploded, and 3 years later, we had to pass another bill, which was the heroin bill in 2015. And so we need to start learning our lessons a little bit, I think. So, number one. And then number two, the second best gift we can give is to rethink our values and start making sure that we're providing a different voice about values to our children than what they're absorbing from other sources, from media and from Facebook and TV and all this other stuff. Because I really feel like that's part of when I say there's something in our social fabric that we need to recognize. I feel like maybe we've lost our way with that a little bit. And our children desperately need to hear a voice that runs contrary to some of the social voices that they're hearing about what's valuable in life and what's important and that sort of thing. So.
All right, and I believe that is a really good place to end. Genre, thank you for throwing that out there. All right, and I want to thank all our panelists for participating. You guys did a great job. Thanks.